My name is Garrett Chandler. I'm a student of respiratory care at Fort Ozone Tech. And the clipboard says, Mr. Smith is a 45-year-old gentleman. He has a history of smoking. He has diagnosed with COPD. He's having a rotator cuff repair, and he occasionally becomes short of breath when he exercises. He generally appears in good health, but the doctor wants him to be on some breathing exercises to keep his lungs open and after his surgery. What do you suggest? He is 5'9", 235 pounds, and he's on room air. The doctor also ordered him to start on a flutter. So first things first, get all my equipment together. Got the spirometer, the flutter, my pulse ox, and the stethoscope. So first things first, I'm gonna enter the room, make sure everything's there. Hi, Mr. Smith, my name is Garrett, I'm with respiratory care. While I'm doing that, put 3 milliliters of hand sanitizer, rub it together, make sure everything's good, rub it vigorously for 15 seconds, put the gloves on, make sure things are clean and dandy. So while I'm doing this, I'm gonna ask him a few short questions. So Mr. Smith, have you been having any shortness of breath recently? He says no, he's okay. His color looks good, there's no signs of cyanosis anywhere. Put this on ready to go. And on this sheet, there's no clear signs of atelectasis, so he's okay there. So when I go up to him, I'm gonna check his hand thing, make sure everything's good. Yes, he has proper identification. So when I get into that, first things first, I'm gonna get the pulse ox. Put the pulse ox on his finger, make it read out for a little bit. That's going on. I made sure everything is in the clear with his identification. Like I said, no dyspnea, no signs of atelectasis, everything's good on the chart. Pulse ox, it's all good. Respiratory rate is at 20. Because when I saw him, he's breathing in, breathing out. You don't want him to know you're doing that, because you don't want to give an excuse for forced breathing. After that, his BPM is around 90. Everything's good. Put my stethoscope on to hear if there's any auscultation. One, 2, 3, 4, 5, 6. Everything sounds good. Go back around. So I'm going to ask him, so Mr. Smith, have you been spitting up at all recently? No, you have not. Okay. Reason why you want to do that, to make sure he has no sputum production. If the sputum production is there, you want to make sure it's a certain color, certain size, certain texture, so you get that in the lab and get it checked out. So first things first, I'm going to ask him, so Mr. Smith, have you had any, have you had an incentive spirometer before? No? Okay. So incentive spirometer is something that you want to inhale with that helps us mostly track your vital capacity. Okay. When you breathe in I want you to breathe in for 3 seconds. Just hold it as long as you can, and we're going to measure it. And just hold your breath for 10 to 15 seconds after that. Okay. So based on his chart right here, he is 5'9", and he's 235 pounds. He's 45 years old. 6 to 8. So we're going to do around 3,000 milliliters. Since it's not there, we're going to put it up all the way. So what I want you to do here, I want you to inhale this for 3 seconds. Then I want you to hold it, but I want to give you a regular goal of 1,750 liters, okay? So we're going to do that. We're going to do it 3 times. Inhale, inhale, inhale. Hold for 10 seconds. Inhale, inhale, inhale. Hold for 10 seconds. Inhale, inhale, inhale. Hold for 10 seconds. The reason why we do this one, I want to see if he coughs up anything. It's good for clearing up any secretions that's there. But I do want to let him know that one of the hazards is you might get lightheadedness. So when we do this, just let me know if you have lightheadedness, so you don't hyperventilate, make things difficult. So you're on safe hands. So the main reason why we want to keep this in order, we want to basically check out your breathing system. We don't want to make sure everything's there after surgery, post-op. It seems like it's post-operative, so when I do that, I would want to put a pillow on his stomach, called splinting, so the incisions doesn't come out. Keep everything together. Helps with pain, helps with the management, helps things keep things clear. But the doctor also recommended that he should be on a flutter device. So I'm gonna bring it up, show come to him saying, okay, Mr. Smith, this is a flutter device. You're basically gonna breathe into it. You're gonna make it spin, make it whistle noise, and that's gonna clear up any secretions that are inside your lungs. Okay, have you done this before? No? Okay. So we're gonna do it. Just gonna breathe out. Perfect. It's making a whistling noise, that means it's working. The main thing you wanna do is you wanna make sure this thing right here is dilated in the proper way. You wanna have a certain resistance when you do it. Okay, things are good. Okay, put a little resistance up, make sure everything's fine. Perfect. We'll do it one more time just for safekeeping. Perfect. Back down. For the IS, you want to do it every 10 times per hour, just to keep things steady and clean, make sure everything's good. Have a clear assessment for the doctor that sees them. For this one, you do not want to use this one over 15 minutes. Okay. Both of these have hazards of lightheadedness. It's you don't want the patient to be lightheaded when you're doing this. You don't want to faint. Hyperventilation is a big thing. It messes up a lot of the readings. So with that, we're gonna see if there's any sputum that comes up. There wasn't, so we're not gonna take that into processing. We're gonna check his vitals once more. Vital in. Okay. Readings are good. Respiratory rate's good. Perfect. Listen once more. 1, 2, 3, 4, 5, and 6. Everything sounds great. Go back around. The main thing you want to do, you want to get these two and put these in handheld regions so they can do it on their own. Make sure they can do it. He knows how to do it. He knows where his goal is. So if he needs me, I can come back and check on him. So I'm going to ask him, all right, everything's good with you now? Mr. Smith, you feeling okay? Okay, so I'm gonna leave you alone for a little bit. Someone should check up on you, and I'm gonna come back whenever you need me. Just make sure everything's okay. Vitals are clean, vitals are good. Okay, he looks like he's good. So I'm gonna write down everything on the sheet, make sure everything's there and it's clean. Make sure all the information is there for the doctor when he comes back in. Do you need a blanket or anything? No? Okay, perfect. Clean up all trash and things there, just keep the room tidy. Leave the room, go outside, take off my gloves, put it in there, make sure it's properly disposed of, wash my hands, make sure everything's good, throw away, write down any information that I missed, and give it to the doctor. Thank you. My name is Gary, I'm a respiratory student at Georgetown Tech, and we have a patient here. Mrs. Jones has pneumonia. She's coughing up thick secretions, and her chest x-ray shows a mucus plug in her left upper lobe. The doctor has ordered for our chest PT 3 times in a day. So what we're gonna do, we're gonna come in, assess the situation while we're talking to her. Hi, Mrs. Jones, how are you doing today? I'm gonna wash my hands, get everything done, put some hand sanitizer on, about 3 millimeters, rub it for 15 seconds, go done, glove up, make sure everything's there. So your doctor had said that you had a chest x-ray and you say, I'm here for your chest PT. So since it's left upper lobe, we're gonna set her up. We're gonna get to her anatomical left position, which could be right here. We're gonna place it down. Imagine you're sitting up. You're gonna cup your hands. This is really important. You're gonna cup her hands. And you should do this motion for about 5 to 10 minutes. Make sure everything's good. Keep going up. The reason why we do this, we wanna try to clear up any secretions, any mucus that's there. It's important for the patient to do that, you know. And afterwards, we want to try to ask them, saying, hey, could you cough for me? Can you take a big deep breath? If there's any sputum, you want to take a sample of that. Write it down, collect it, give it to the lab. Afterwards, you're going to do that 3 times in a day. So you're going to come back, do it again, 5 to 10 minutes. Afterwards, same thing, 5 to 10 minutes. Make sure everything's good. We'll leave. I'm going to write down the information for the doctor, so everything's cleared up. There's no sputum sample to be taken. Come back, write that, leave the room, wash up, take everything out, gloves off, throw in the trash, write down the things that are needed for the doctor. Any modifications need to be made is none. And that's it.